Sound check 1 2 3. Sound check 1 2 3.
Morning, everyone. Hope everybody had a lovely long weekend with family and friends and a little bit of a break. Welcome to the Public Health Committee. We will start our meeting. We have in council chambers, good morning, Councillor Meekin. We have Councillor Jackson, Councillor Meekin, Councillor Wang, Councillor Maureen Wilson, Councillor Francis, Councillor Taddison. We have Councillor Alex Wilson, Councillor Clark, Councillor Kretsch, Councillor Kassar, and joining us virtually, we have Councillor Danko and Councillor Pauls. So thanks everybody for being here for this Public Health Committee meeting. Mr. Clerk, are there any changes to the agenda?
Yes, Madam Mayor. Item 5, communications, 5.1 and 5.2 were revised as the attachments were revised as the items were placed incorrectly on the agenda. As well, the recommendation for item 5.1 has been revised from be received to now be received and referred to the Medical Officer of Health for analysis and report back to the Public Health Committee. There is also one added notice of motion, item 12.1, resolution to declare the City of Hamilton a no paid plasma zone. Those are the changes to the agenda.
Okay, thanks very much. I guess I should have officially called the meeting to order and remind people about the electronic devices that are to be switched to a non-audible function during the committee meetings. And I just noticed Councillor Beattie was coming in, gave me a bit of a wave, so I expect that meant he's on his way in the chamber, so that's good. Quorum is present, so after having heard the changes, can I get a motion to approve the agenda, please, as amended? Moved by Councillor Taddison, seconded by Councillor Wang. Can you please indicate your votes? I already did, yeah. Thanks. That's carried 13-0. Thanks very much. We're now on to declarations of interest. Are there any declarations of interest? Seeing none. Thanks very much. We'll go on to the approval of the minutes of the previous meeting, February 5th, 2024. May I please have a mover and seconder to approve the minutes of February 5th, 2024's meeting? Moved by Councillor Wang, seconded by Councillor Kassar. Any discussion on those minutes, folks? Seeing none, we'll go to the electronic vote, or the thumb vote. That carries 13-0. Thanks very much. Communications. May I please have a mover and a seconder to put the communications items on the floor? Please, moved by Councillor Alex Wilson, seconded by Councillor Taddison. Any discussion on the communications items? Councillor Maureen Wilson, please. Vice Chair.
Thank you, Mayor Horvath. On communication item, and I apologize to Elsie Gauthier, the correspondence from Frontenac, Lennox, Addington, 5.2, it is revised, I believe, to be endorsed. No, could you just remind me? My apologies.
Through the chair to the councillor, the revised item is 5.1 from Peterborough Public Health, and that's revised to be received and referred to the Medical Officer of Health for analysis and report back to the Public Health Committee.
Thank you for that clarification. I was hoping, if I could, on the correspondence from Mr. Westgarrett, if I could have someone from Public Health speak to the body of the letter through the chair on why we're endorsing it and what is the movement of foot, if you will.
Okay, sure. Dr. Liu, please go ahead.
Thank you. Through the chair to the councillor. So this letter is respecting the Public Health Ontario laboratory system, as well as possible changes to that lab system stemming from an Auditor General report on value for money for the Public Health Ontario lab system. To speak to the body of the letter itself, I'm going to defer to Director Jordan Walker.
Director Walker?
Thank you, Dr. Liu. Through the chair to the councillor. So this report, as Dr. Liu alluded to, or this correspondence makes reference to Public Health Ontario plan or planning with respect to an Auditor General, Office of the Auditor General report that came out in December of 2023, sorry. A number of items within that report, but one of which referenced streamlining laboratory operations. And so specifically within that report, it made reference to a 2017 report which indicated the closure of 6 of the sort of regional laboratories under Public Health Ontario Laboratory, Kingston being one of them. And so the letter within outlines Kingston's concerns with the closure of that public health lab. Hamilton also has a local laboratory of the Public Health Ontario Laboratories. It's located up on the mountain. And so the reason for endorsing this, and we share similar concerns as those outlined within the letter. With the proposed laboratory closures, including potentially closure of the Hamilton Public Health Ontario Laboratory, just want to express our concerns, as of course that laboratory has been both a valuable partner to supporting our local health system in terms of monitoring for and responding to infectious diseases and diseases of public health significance. Certainly having access to a laboratory locally and having that local expertise has supported us both from a planning perspective as well as in response to emerging issues. So for instance, very significant support and laboratory surge capacity provided throughout the COVID-19 pandemic. A more recent example of ways in which a local laboratory is able to support is through the cybersecurity incident, where we were having difficulty in terms of accessing lab reports through usual means. We were actually able to physically obtain those from the laboratory, and certainly that was made very accessible by virtue of the fact of having that laboratory close. And so we have similar concerns to those in the letter with respect to those closures, that loss of local expertise, as well as the availability of having those services located within Hamilton. Would certainly impact the ability of the laboratory system here in terms of its ability to respond to surge capacity. And certainly that, if you look at what was sort of required in terms of response throughout the COVID-19 pandemic, the value in having that local expertise as well as the ability of the laboratory system to have that additional capacity and that additional surge has proven invaluable. And so certainly, while we appreciate the intent of the Auditor General's report with respect to sort of finding efficiencies, we would just like to express that we would hope for a collaborative approach in terms of determining solutions that might maintain that local expertise of the laboratory as well as maintaining that surge capacity.
Thanks very much. Councillor Wilson?
Thank you, Mayor Horvath. I'm not sure whether my next question is in order. It has to do showing my ignorance on the Auditor General's report. I wasn't aware of that. And if the staff member is familiar with it, I'll stop there if it has been read and consumed. And my question was going to be, does the Auditor General's report speak to, is this inherent tension between the value of having something local, the local accessibility, local knowledge, the partnership and alliance that's been formed, and the tension perhaps with the operational cost, if you will? Are you able to speak to that? Or if not, I can just take it offline through the chair.
Director Walker? Dr. Liu?
So the 2023 Auditor General report does make reference to an earlier report from 2017, which spoke to the specific closure of specific lab sites. And in the 2023 report, it does identify that as an area of consideration around streamlining laboratory services within Public Health Ontario and efficiencies. So it does not specifically indicate that those sites would be closed, but brings it forward as an item for consideration in that process. So the focus in the report is more so around those items of streamlining operations and efficiency than the other described areas.
Thank you, Chair.
Thanks, Dr. Liu and Director Walker. We're open now for any other discussion on the communications. Seeing none then, can I get, I guess I already have a mover and a seconder. I think that was moved by Councillor Wang, or Councillor Wilson, and seconded by Councillor
It was Councillor Alex Wilson and Councillor Tattison was the
Tattison.
seconder.
Okay, great. So we have it moved and seconded, and we've got no further discussion, so we'll take that vote, please. I'll take the thumbs up. For some reason, my vote's not coming up, but I am online now. That carries 14-0. Thanks very much. We're on to the consent items of the agenda. I'm just looking at the time. It's 9:42, and just FYI, at 10 o'clock, I have to step out for about 15 minutes.
Sorry, we're on delegation
Delegations,
request.
yeah. Thank you. So I'm going to ask at 10 o'clock, Vice Chair Wilson, Maureen Wilson, to please take the chair. I'll be out for about 15, 20 minutes. So delegation request. May I have a mover and a seconder to put the delegation request on the floor, please? Moved by Councillor Alex Wilson, seconded by Councillor Kretsch. Is there any discussion on the delegation request that's before us? Seeing none, we'll go to the vote. Please go ahead and put the vote up. That carries 14-0. Thanks very much. Now we're on to the consent items. Thanks for keeping me on track there. 9.1 is City of Hamilton support for SCORE program BOH 24007 citywide. It's from the outstanding business list. And we'll get that on the floor. Can I please have a mover and a seconder to put item 9.1 on the floor? Moved by Councillor Francis, seconded by Councillor Kretsch. Any questions on that report? Councillor Wang, please go ahead.
Thank you. I do see that in this report, through you, Chair, is the expansion will go to 1, 2, 3, 5, and then 8, 14. Just wanted to get a sense from the team that worked on this. Ward 4 does happen to have a significant amount of newcomers as well, and it is also part of it kind of feels like there's a little bit of a gap there. Just wanted to get a sense for how Ward 4 was excluded from the expansion.
Okay, thanks, Councillor Wang. Okay, Director McDonald, please.
Good morning, Mayor. Through you to members of committee. Kevin McDonald, Director of the Healthy Environments Division within Public Health Services. Thank you very much for the question, Councillor Wang. Subsequent to the council direction this past December, when Dr. Anand presented with her team to committee, and we went away and marshaled together not only members of the SCORE project team, but the relevant city departments and divisions leadership from within. This report was constructed with a sightline in terms of what's currently happening, as well as what the SCORE project team is projecting outward. I would defer to the SCORE team, and we have a representative, Irene, on virtual this morning. Perhaps she can speak to the processes that went into their expansion projections and plans.
Okay.
Good morning, through the chair to the councillor. I have to be honest, I am fairly new to this project. We were brought on through Children and Community Services, and I'm an early years manager, to connect services through the early centers. I'm doing a walking tour with them in a couple of weeks for Ward 2, and to connect them to youth programs, to the fee subsidy. I am not familiar with how they chose which wards they would be going to. I don't know if there's anyone here that's from the SCORE program, but they are very committed to the program, and I mean, I'm happy to bring it forward to the group. Councillor Wang.
Okay, thank you. Through you,
Councillor
Mayor.
Wang.
Perhaps just as Manager Heffernan is actually going to have a walkabout with them, perhaps she can also remind them that Ward 4 does have the Boys and Girls Club, and it is also in the North End, and traditionally has been seen as more of a very diverse income sort of population. So there is a lot of newcomers and new families that are coming into the ward, specifically because we also have a significant amount of elementary schools in both the public, private, and Catholic systems. And so I think that there's an opportunity for Ward 4 for their consideration, perhaps in a phase 2 expansion. Thank you.
Thanks, Councillor Wang. Thanks, Manager Heffernan.
Thank you.
We're all good then? Okay, any further discussion on this item? Councillor Maureen Wilson?
Thank you, Mayor Horvath. I just think this is a really great report, and I think all the staff members who worked on it should be able to kind of speak to how they did it and kind of the essence of their recommendations. I'm really, really thankful and appreciative of all of those that cross-jurisdictional or cross-departmental review. So if I could ask through you, if staff could just give a little, just for folks who may be new to this, what is SCORE, but if you could start by identifying the location, tell us about Riverdale, and tell us about what the ask was, and then tell us about, if you don't mind, what you delivered. Thank you, through the chair.
Thanks very much. I'm looking over to the bench.
Yeah. Through the mayor to members of committee, I'll ask Heather Harvey, our manager of chronic disease prevention, who spearhead this with our colleagues across the city of Hamilton and with the SCORE team from McMaster.
Manager Harvey, welcome. Please go ahead.
Good morning. Thanks for the question. Through the chair to you, Councillor. So a little bit of background, good morning, on SCORE. This is a project spearheaded by Dr. Sonia Anand through McMaster, looking at chronic disease reduction and prevention, specifically focusing on newcomers and newcomer youth. And so their initial phase of the pilot was their project was a planning phase that took place in the Riverdale neighborhood because of the large percentage of newcomers in that area. And so the planning phase was really looking at and working with the community using a co-design model. So working with the community, trying to co-design interventions that would help to reduce risk of chronic disease. The city partnered with SCORE. We were brought in a number of ways. So public health, recreation, public works, I think, all sit on their multidisciplinary stakeholder committee. But in addition, SCORE has worked closely with recreation as well as the school boards in the Riverdale neighborhood. So at Lake Avenue School and Dominic Agostino Recreation Center, looking at ways to increase access to physical activity opportunities specifically in those areas, but working with our multi-sectoral group to reduce barriers in a number of ways, looking at access to outdoor spaces, indoor spaces. I believe there was a tree planting exercise. And so we've been meeting with SCORE throughout this planning phase to help identify solutions to any barriers or challenges that they've been a part of. Dr. Anand came and spoke to Public Health Committee, I believe it was in December, and spoke about the next phase of their work, which is their implementation phase. So it's an expansion, taking what they've learned in this planning phase, taking it across the city to other neighborhoods with high proportion of newcomers, which is how those wards were identified. At that time, Public Health Committee charged the city staff to look and talk to Dr. Anand and look at potential ways we can support that. And so we came together with Dr. Anand earlier this year and then again as a group. And as you can see in the report before you, identified a number of ways in which the SCORE program aligns with existing city services and strategies where we can leverage those existing services or enhance them slightly without cost to really support the rollout of SCORE across the city. And so that's what you see in front of you. And that included staff from public health services, recreation, and children's and community services, specifically early years.
Okay, thanks very much. Councillor Wilson?
Hey, thank you very much for that thorough overview. And again, I just wanted to express my gratitude in Appendix A for folks who are following along, is the expression of all the opportunities that the city through various divisions and activities are supporting this initiative of Dr. Anand's, and I just wanted to highlight that. Thank you again.
Thank you, Councillor Wilson. Any further discussion on this item, 9.1? I'm sorry, was there? No? Okay. Thanks very much. Then we'll go to the vote. That carries 14-0, thanks. We're on to item 9.2, which is monitoring heat-related deaths and illnesses in Hamilton. May I have a mover and seconder to put item 2 on the floor, please? Moved by Councillor Kretsch, seconded by Councillor Wang. Any discussion on this report, 9.2? Councillor Wilson, Alex Wilson, Councillor Kretsch. Go ahead, Councillor Wilson.
Just a quick note of thanks to staff on this one and the next one. I think having this information with the best data we have, again, there's no secret way to measure everything. It's about how these things get recorded. So being able to see how different types of data get recorded at different interactions with health systems by Hamiltonians is really valuable for both heat-related deaths, injuries, emergency department visits, as well as opioid-related poisonings and opioid-related toxic drug supply incidents as well. And so having these pieces of information reported quarterly is just very valuable. Thanks to staff for doing that work. I know this is a change that this council requested, so just want to acknowledge that we've asked for this work, and I do believe that it is useful, so thank you.
Thanks, Councillor Wilson. Councillor Kretsch?
Thanks. I also just wanted to highlight a few things here. I think it's very important to have this data, especially as we consider what municipal law enforcement staff are working on with respect to a bylaw for adequate temperature in the city. I don't notice that that's mentioned here at all, and I understand why you wouldn't necessarily be preoccupied by that. But I wonder if I could put a motion on the table to refer this to the Director of Municipal Law Enforcement Services, so she has a copy of this report. When they're developing that bylaw, is it possible to do that so they can have a copy? I know we don't always share these things, and no one from that department is here at Public Health, so.
I don't know that we would need a motion for the material to be shared, but if staff thinks we need, I mean, if you want to put a motion, I think it's in order, but I would suggest that this is material that would be shared by staff regardless. I see nods from GM Mader and nods from Director McDonald and from Director Prieto. I think it's pretty clear that everybody's kind of engaged with this. Am I correct? Yes? GM Mader, please.
Through the chair, absolutely will ensure that Planning and Economic Development and the Director Cirillo is well aware of it. We'll share the report.
Thanks, I appreciate it, because the study here talks about not only statistics from 2011, but also some modeling from last year. So I think seeing those changes and impacts and talking about that window from May to September is important. We're also, of course, talking about heat-related illnesses and deaths. Doesn't mean there aren't impacts outside of the May to September period. So I think having this data and having more nuanced discussions about it are really important. So thank you for this report.
It's also clear that this is something that affects seniors significantly. We have a growing, aging population in Hamilton as well, and a commitment to have our city be the best place to age successfully. So thank you very much for that, Councillor Kretsch. I don't see any further speakers on this one. So if we could, let's just go to the vote. Yep, thumbs up. That carries 14-0. Thanks, everyone. 9.3 is suspect drug-related deaths and opioid-related paramedic calls, September to December 2023, BOH 24006, citywide. Could I have a mover and seconder, please, on this one? Moved by Councillor Tattison, seconded by Councillor Wilson. Any discussion on this one? Councillor Wilson? No? Any discussion at all? No? Okay, then we'll go straight to the vote. That carries 14-0. Thanks very much. Let's see, item 10.1, selection criteria and policy and bylaw changes to implement the Public Health Subcommittee, Board of Health 24003, citywide outstanding business list item. Mover and seconder, moved by Councillor Kretsch, seconded by Councillor Tattison. To put that on the floor, any discussion on this report? Councillor Kretsch.
Yeah, I'll be brief. Just want to really thank staff for getting this to us, even though I know there's been a number of challenges in terms of the cybersecurity incident and getting all these reports in front of us. There was a commitment to April, and we got there for April. I think that's really important. There's a very comprehensive set of appendices that go over changes to the procedural bylaw. They talk about the composition, and it looks like basically from my reading that what they've done is taken all the feedback, all the engagement, kind of condensed it down, used some of the examples from Toronto and other places and indicated where they did that, and put something forward that I think is helpful and I think is going to lead us to a good place, right? It seems to match what we heard from the engagement. It seems to match what everyone around the table wants to have done. It's the next step in this process to getting the Public Health Committee transformed again to the Public Health Subcommittee, and then getting those community folks involved as we wait for the province to do its work. So just really grateful for this. I know it's taken a long time, but I think we're finally going to get there.
Thanks, Councillor Kretsch. Any other, Councillor Danko, please. We can't hear you, Councillor Danko. There we go.
Unmute.
Excellent.
I do have a minor amending motion for Appendix A, the selection criteria. So if you could come back to me after you've gone through the speakers list.
Okay, I'll come back to you. We have Councillor Wang.
Thank you. Through you, Mayor, I don't know if I see it, but what is the time frame for when do we start with all of this work?
Thanks, Councillor Wang. Director Vickers, Manzin, please. Manzin.
Jen Vickers-Manzin, Director of Healthy Families, Chief Nursing Officer for Public Health Services. Thank you for the question through you, Mayor, to the councillor. So what we are targeting alongside clerks and the selection committee is pending approval of today's report. We would move forward through the recruitment process with a target of about the summer to have recruitment complete, but I'll just see if clerks have anything else to add to that.
Thanks.
Through the chairs, once approval by council, the recruitment or the application period will begin, and that's expected to be 4 weeks. So from after those 4 weeks, it'll be then up to selection committee.
Okay, thanks very much, Councillor Wang.
Perhaps just another procedural type question then. After, the fact is we're still going through a cybersecurity recovery and rebuild. So what does that look like? What does that, how do we put this out there? Because we're also not really putting anything, we're being very careful as to what we're putting out there. So I'd like to just understand, how are we actually doing that recruitment? What does that process look like given our current situation?
Okay, I don't know if that's best for Director Vickers-Manzin. Please go ahead.
Thank you, Councillor, for the question, and through you, Mayor, to the councillor, and I'll give clerks the opportunity to add anything that I may have missed. We do have approval through the EOC already to move forward through the recruitment process. for this subcommittee of public health. And also, in addition to that, we have key messages already crafted, as well as several plans in terms of where advertisement will happen across both social media channels and the Spectator and our other local papers as well. In addition to that, we will be reaching back out to those organizations and individuals that were part of the consultation process to put word out through those individuals and organizations that recruitment will be underway and that the posting will be up for 4 weeks. And I'll just turn it over to clerks to see if I've missed anything.
Please go ahead, Clerk Gauthier.
Through the chair, I have nothing further to add. That was fulsome.
Thank you.
Thanks. Thanks very much. I'm going to be turning it over to Councillor Wilson, and I'll be back very shortly.
Okay.
Thank you.
Through the chair then, another question is, during the recruitment process, will there be a comms package that could be shared with, say, councillor offices as well that might include specific messaging or consistent messaging that we can just help pitch and promote to get this as wide as possible to the largest audience as we can? Through you, Chair.
Director.
Through the chair to the
Jennifer?
councillor, thank you for the question. Yes, we can do that.
Thank you. Those are all my questions.
Okay, you're stuck with the B side of the record here. Are there any further speakers? Councillor Clark, please.
Thank you very much, Vice Chair Wilson. Can I ask, I was under the impression that one of the rationale for going down this road was to gain some experience on the committee from the health sector, nurses, doctors, regulated health professionals. At least that's the way I understood it. And yet when I see the scope, I see no mention of regulated health professionals. This looks like it'll be just a general public committee.
Director Jen.
Through the chair to the councillor, thank you for your question. I'll just maybe highlight a few things before I come to the specific answer to that. But in particular, there was a number of skills through the consultation process and competencies and perspectives that were really highlighted to be valuable as part of the public health subcommittee. And due to the number of different perspectives that were seen as valuable in consultation, we didn't designate specific seats. When we looked and considered what we heard through consultation, what we saw through recruitment in the committees in Toronto and Ottawa. Also, what we looked at was the amending motion and what we heard from best practice governance training from CREMA. But when we looked at our healthcare providers during consultation, there were so many different types of health expertise that were seen as important. Consultation participants saw having Board of Health members expertise, for example, in mental health, primary care, hospital care, long-term care, and epidemiology, as well as expertise from those who provide frontline health and social support. And so there was a breadth of health expertise that could contribute, which was why there was no specific qualifications listed. Rather, we highlighted in some other criteria around interest and experience.
Councillor Clark.
So respectfully, what I recall the debate about was getting expertise on the committee. That's what the debate was. And it was stressed very much by almost everyone around this table. We talked about regulated health professionals, doctors, nurses. Those are the people that we wanted to have on this committee so that we could have insight, not just from our public health staff and all the experts that are there, but that was the intent of this. And now that seems to have been flushed. It's gone. It's nowhere in the report.
Okay, I think the question, if you're seeking further clarification from the answer that's already been provided, if you could focus in on what still is not been provided. Otherwise,
The answer, I didn't get an answer to the question. Why is that not here? That's what we asked for, with the greatest of respect. It's not in this report.
so your question is you're looking specifically for a criteria that references a regulated, registered health professional?
All of the debate, Vice Chair, was regarding ensuring that we had healthcare expertise on this committee. That was the initiative. And now that is not even in the report. This looks like it could be anybody with some experience in the community offering a different perspective that could now sit on this committee. But that was not the intent. The intent was, we're not doctors around this table. We're not nurses around this. We're not regulated health professionals. That was the motivation and rationale. And then I see the implementation to move forward does not include any of that rationale. So I'd like to know why it was removed.
I believe Councillor Danko might have an amendment which speaks to this, but my understanding of the debate, and I'll take the chair's prerogative before putting staff in having to provide further clarity, is that there was an intersectional nature to
With
health.
respect, Vice Chair, I'm simply asking staff.
Yes,
I'm
it's
not
been
asking
asked.
your perspective.
Yes, thank you. It has been asked, and I believe Director Jen has sought to answer it. I was asking you what further clarity needs to be brought from staff so that we can answer your question.
Why isn't it in the report if that was the debate? That was the rationale. Why is it not here? That was my question. This is the third time I'm asking.
Dr. Jen, or Director Jen, is there anything further you would like to add that you haven't?
Thank you, Councillor, for the question, and through you, Chair, to the Councillor. There's nothing more that I would add other than what I already articulated around the many desired skills and competencies that came forth not only through discussion at Public Health Committee, but consultation with the broader community, and this is what's led to where we've landed with the criteria for your consideration today.
Thank you, Vice Chair.
Thank you, Director. Councillor Danko, you are next on the speakers list. However, you did indicate that you're willing to wait until I'll speak. Okay, yes, I'm seeing a nod. Councillor Kretsch.
Thanks. I understand what Councillor Clark's getting after, but I do really remember a very specific dialogue as part of all this discussion with Dr. Richardson. And what she'd said at that time, and I'm just going to ask staff to confirm I haven't lost the plot. What she said at that time was the nature of public health isn't the same as the nature of the medical profession. And when we do have on that really specific language about Ontario regulated health experts, as Councillor Clark is suggesting, what that does is it suggests that there aren't any other kinds of experts or expertise we would want to have involved in this. And so both the engagement from the community and the consultation from the feedback we had, plus the presentation we had from a very qualified person on the subject here in front of council, all suggests that we might want to consider other health experts. An example, I'll give you one, which is folks who live in a shelter. Not live in a shelter, but work in a shelter. So you have people on the front line working in shelters, delivering health services who are not part of regulated professions. And there are so many people who are part of unregulated professions, but that have something that could contribute, especially to a public health board. So I'm wondering if staff could just articulate that difference that I think the public health subcommittee will be focused on versus what you'd be getting from like a medical board. Or something like the Royal College of Surgeons or something, right? Like, what's that distinction between those two things?
Thank you, Dr. Liu.
Yeah, so public health is certainly an area of study and expertise that is aligned and overlaps with that of healthcare, but is not a perfectly aligned circle. Where somebody is a regulated health professional, that does lay out specific obligations and duties with respect to their work within that regulated health profession, which work on a board or a subcommittee would not necessarily encompass. So that would not be work or practice within the scope of the regulated health profession to perform that work as part of a group or any sort of board outside of their practice within that regulated health profession. And there certainly are many healthcare professionals who are not do not fall within the scope or purview of a specific regulated health profession.
Thanks, I appreciate that. Just a final comment. Just that's one of the things that came out of this discussion as well, was that yes, we wanted to make sure we had expertise. That was the word that was used. And there's just so many, one of the things that was talked about during COVID specifically was the inclusion of frontline workers as part of these conversations. And we know that many of the professions that involve frontline workers aren't as regulated as you would get when you're talking about RPNs or doctors or other kinds of things. So I think that I don't want to pre-speak to Councillor Danko's amendment, but I think he's proposing a preference, right? Which I think is probably better than a criteria. I'll leave it there. Thanks.
Thank you. Councillor Jackson.
Thanks, Acting Chair. Maureen Wilson. Since it's been a while, can I just get a refresher of my memory what's here before us, please? As you recall, I was probably the last holdout to going along with this direction, just due to all the reasons I've stated over the last couple of years. Anyways, I just want a refresher now. In moving forward with replacing our Public Health Committee with this interim Public Health Subcommittee, Council will remain as Board of Health, correct?
Look, I can nod my head, but I don't think that's sufficient, and nor the job of the chair. So I'll look to staff to give you that answer.
I'll take your nod as a preview to staff's response, please, through you.
Through the chair to the councillor, that is correct.
Thank you. Director Vickers-Manson, supplementary now. If the province were to deny the request for the semi-autonomous Board of Health permanently, then what we have in place as of this report, if approved, would carry on then indefinitely, and Council would continue to be the Board of Health if the province were to deny City Council's request. Through you, Acting Chair Maureen Wilson, and you can give a little preview nod if that is the case, please.
I don't want to get in trouble, Councillor Jackson. Dr. Liu.
Yeah, through the chair to the councillor, that is correct.
Thank you very much, Dr. Liu. Thank you, Acting Chair.
You're welcome. Any further speakers wanting clarification? If I could ask the previous Deputy Mayor from March, Councillor Kretsch, to take the chair for a moment. I just have a question of clarification of part of an answer that was provided. Through the Acting Chair to Dr. Liu, I am interested in Councillor Danko's forthcoming motion, and I think there's a misunderstanding, at least on my part. I thought you stated that there are a number of active health professionals who fall outside of a regulated health profession in the diversity of the public health sphere. Could I just ask, if that is what you said, if I could ask through the chair, could you give me an example so I could understand what that means? Through the chair.
So through the chair to the councillor, so there's an incredibly wide diversity of health professionals that might be working in providing health and social services for individuals as part of direct social or clinical services, and so that could include things such as social service workers, things such as addictions counselors, any health profession that doesn't necessarily specifically relate to controlled acts, for example, such as that a nurse or a physician might perform, might be someone who has considerable involvement in the health field, but would not necessarily have a regulated college that they would be reporting to or under the Regulated Health Professions Act.
Okay, thank you. And if I could ask then another clarifying question, just so that I understand, and I, through the acting chair, my apologies. The consultation that was done to ultimately inform this recommendation that is before us now, it intentionally, therefore, I don't want to put words in staff's mouth, it intentionally left it in this way so as not to preclude the aforementioned folks that Dr. Liu referenced or not, through the chair?
So to the councillor, through the chair, so certainly it would be the scope of the selection committee to ultimately review applicants and provide recommendations about applicants to that selection committee. And this would, certainly this application could include people who are regulated health professionals and people who are not regulated health professionals.
Okay. That's very helpful and helps inform my, further informs my opinion. Thank you, and I'll assume the chair. I appreciate your help. Councillor Danko, I don't have any further speakers, so the floor is yours.
Thank you. This is an amending motion to Appendix A, further to this discussion, moved by myself, seconded by Councillor Pauls, that we add in a point that preference will be given to applicants who meet the following criteria, that we simply add in the point that the applicant is a Ontario regulated health professional in good standing. So this would not be a requirement that they must be a regulated health professional in good standing, simply that preference is given to applicants who do meet that qualification. So if I could just speak to that, I think that's pretty straightforward. Again, to Councillor Clark's point that the entire point of bringing on citizen members to the Board of Health was to bring in public health expertise. So the way that you do that is to actually ask for public health expertise in the applicants. So as was mentioned, public health expertise, healthcare expertise is not mentioned at all in the report or in the selection criteria. And I think the clearest, simplest way of doing that is simply to add in a point of preference for applicants who are regulated, Ontario regulated health professionals. And just so everyone's aware, this is a very wide list. It's not just doctors and nurses. It's audiologists, chiropractors, dental hygienists, dietitians, homeopaths, kinesiologists, massage therapists, midwives, naturopaths, nurses, occupational therapists, pharmacists, respiratory therapists, traditional Chinese medicine practitioners, anyone that is a regulated health professional in Ontario. So I think this is a fairly extensive list, but at least it gives us some certainty that we are actually asking for people that have a healthcare expertise to provide that expertise through their role in the public health subcommittee. So that's the amendment. As I said, I think it's pretty straightforward and self-explanatory, but I'll just leave it at that. Thank you.
Thank you, Councillor Danko. And Elsie Gauthier has just given me some guidance that it would be an amendment to Appendix A and C, just for your information. Okay. Any speakers to the amendment, please? Okay, I will recognize, just because it was in my view, Councillor Alex Wilson, followed by Councillor Taddison. Thank you.
Thank you. Again, I think adding something to a list of criteria as a preference is not a black and white criteria. Like, there's also a preference that folks are bringing knowledge of health equity concerns, anti-racism, other types of considerations. So if we had two hypothetical applicants, one who's part of a regulated college and one who's, for example, maybe a disability management specialist who got there, who has both an undergraduate degree and a certificate from Mohawk College, but is not part of a regulated professional. 1/3 of Hamiltonians live with a disability. Maybe they're doing frontline work in that sector. They're helping people access systems. They'll have a better systems eye view than maybe a regulated professional. That's where those multiple criteria come in. So I'm against this change today. I think the breadth is what gives the selection committee the most ability to ask questions of applicants and really get to the what is the expertise that our public health committee needs, not limiting that to a regulatory field. I do also understand where the concerns are coming from and don't think that this is really that limiting either in terms of it depends on who the applicants are coming forward, and there can be multiple criteria that we're weighing. This is just potentially adding some expertise and preferencing some expertise over others. Hearing from some committee members that may be the intention, and that's I don't think that's the end of the world, but I'll be voting against, but it's not I think we can get a great committee, and overall this is a positive change, and really appreciate Councillor Danko trying to tighten that. I think a little bit looser here, though, is what's going to give us the best chance of getting the most folks.
Councillor Taddison.
I think I'd just like to ask the bench a question and then the mover another question. But anyone on the bench up there, will this amendment, I think this is what I heard, that will this amendment limit participation of experts who could be a valuable service and perspective on the Public Health Subcommittee?
Dr. Liu, please.
Through the through the chair to the councillor, my understanding of the motion as it's on the floor is that it would be a preference and not a strict requirement or criteria, and so I don't believe that it would restrict any particular applicant.
Thank you.
Okay, thank you. So if I heard that correctly, it won't really restrict applicants, correct? Is that what you just said?
Through the chair to Dr. Liu, one more time.
Through the chair to the councillor, that would be my understanding, yes.
Okay, thank you. To the mover of the amendment, could I just ask, as a member of the selection committee, I'm trying to understand what you operationally define as preference.
From Councillor Taddison to Councillor Danko.
Well, Appendix A has criteria for the selection committee and preferences given to applicants who meet the following criteria. So it'd be one of the many preferences on that list. And then not any one preference being more important than any other one, but it would be the only specification that has any actual public health expertise.
Okay, thank you, Councillor Danko. I appreciate that.
Any further speakers on the amendment that has been duly moved and seconded? Seeing none. The amendment's on the floor for a vote. That amendment carries with 11 in support, 2 against. Thank you, colleagues. All right. On the recommendations and report as a whole, please, and thank you. A thumbs up from Councillor Taddison. That carries 13 to nothing. Thank you. Regrettably, Mayor Horvath is still away, so we are on notices of motion. And I will introduce her notice on her behalf. If I could ask Councillor Kretsch to take the chair. Thank you. It is 12.1, a resolution to declare the City of Hamilton a no paid plasma zone. It will remain a notice for folks so that you can make your own inquiries, and it will be up for debate at the next public health meeting. I don't think I need to speak to the body because we're just serving. Okay, thank you. Okay. I'll assume the chair from Councillor Kretsch. Thank you again, Councillor. On to general information. I need a mover and a seconder to approve amendments to the OBL. Moved by Councillor Jackson, seconded by Councillor Wang. Is there any discussion on those OBL changes? Seeing none.
Councillor Beattie.
Oh, carries 13-0. I was thought. Thank you. We're on to an adjournment. It's moved by Councillor Kassar and seconded by Councillor Alex Wilson that we be adjourned. Thank you for putting up with the B-side. Generous. Carries 13-0. Have a lovely morning.